Welcome to another deep dive. Today we're taking a close look at tracheotomy. We've got this medical lesson handout in front of us, and it is chock full of info. So if you're ready, let's dive into this surprisingly common procedure.
You know, it's funny. I've noticed that a lot of people get tracheotomy and tracheostomy mixed up.
Oh yeah, for sure.
They sound similar,
Yeah.
but they have different meanings.
Right.
A tracheotomy is the actual surgery. It's when they create the opening in the windpipe.
Okay.
The tracheostomy is the actual opening itself.
So the tracheotomy is like the verb,
Exactly.
and the tracheostomy is the noun.
Precisely.
Got it. So why would someone need this opening in their windpipe?
Well, sometimes a person's airway gets blocked.
Okay.
It could be from an injury or a tumor or swelling.
Makes sense.
And the tracheotomy provides another way for air to get to the lungs.
Like a detour.
Yes, exactly like a detour.
Sure.
In some cases, people might need help breathing for a long time, like when they're on a ventilator. And a tracheotomy can be way more comfortable than having a tube down their throat.
That makes sense. So it's not just a quick fix.
Right. It can actually be a long-term solution.
I see. I bet deciding to do a tracheotomy isn't a decision that's made lightly, though.
Oh, absolutely not. Doctors consider a lot of things, like how long will the person need help breathing? What's their overall health like? Are there any other medical conditions that might make the tracheotomy risky? The handout mentions losing pharyngeal or laryngeal reflexes.
Okay.
In these cases, they might need a tracheotomy to keep their airway open. It all comes down to what's the safest way to make sure the person can breathe.
So it sounds like there's a lot to think about.
Yeah, definitely. It's about finding the best option for each patient.
All right, so let's say a tracheotomy is the best way to go. What happens next?
Well, there are two main ways to do a tracheotomy.
Okay.
The first is a surgical tracheotomy.
Right.
And this is kind of like a traditional surgery. They make an incision, and they divide some muscles, and then they create the opening in the trachea.
That sounds pretty involved.
Yeah, it can be.
What's the other way?
The second way is called percutaneous dilation tracheotomy.
Okay.
This one's less invasive.
Okay.
And it involves putting a needle into the trachea and then using special tools to gradually make the opening wider.
So it's almost like threading a needle.
Kind of, yeah.
Wow. So there are two completely different ways to do the same procedure.
Exactly. And doctors choose the best method based on the needs of each patient.
So we've talked about why someone might need a tracheotomy.
Right.
And we've talked about the different ways to do it. Now I got to ask about risks. Any surgery comes with some level of risk, right?
Oh, yeah, of course.
Yeah.
And with tracheotomy, there are some specific risks that doctors watch out for. The handout actually separates them out into immediate risks and late risks.
Okay, so immediate risks are things that could happen
within the first 24 hours.
Oh, wow. Okay, got it.
And then late risks are things that pop up a week or two later. You know, understanding the risks is really important. It helps doctors take steps to make the procedure safer for the patient.
Okay, so what kind of immediate risks are we talking about here?
Well, there's bleeding and infection.
Right. Those are risks with any surgery.
Exactly.
Anything else?
Another one is a pneumothorax.
Oh, yeah. What is that again?
It's when air leaks into the space between the lungs and the chest wall.
Okay, that sounds pretty serious. Are there any less common but maybe a little more, traumatic complications?
Definitely. There's something called a tracheoesophageal fistula. You heard of that one?
No, I don't think so. What is that?
It's when a connection forms between the trachea and the esophagus.
Between the windpipe and the food pipe?
Yeah.
Oh, wow. So food could get into the lungs.
Exactly.
Yikes. That sounds like a bad time. Anything else?
Let's see. Oh, yeah. There's the tracheoinnominate fistula.
Wow, that name sounds intense. What happens with that one?
Well, basically, the tracheostomy tube erodes into an artery.
Oh, my gosh.
Yeah, and that can cause some major bleeding.
So that's a worst case scenario.
Yeah, for sure. It's thankfully super rare.
Yeah.
But one of the warning signs is a pulsating tube.
Oh, gosh. I'm getting the chills just thinking about it. What about the late complications?
Well, there's still a chance of infection and bleeding.
Okay.
But you can also have trouble swallowing because the tracheostomy tube can sometimes interfere with the normal swallowing process. So yeah, it's definitely a serious procedure.
Yeah.
With some potential for serious complications.
Right. But we've also talked about how it can be really helpful for people who need help breathing.
Absolutely.
So like you said before,
Yeah.
It's all about weighing the benefits and the risks.
Exactly.
For each individual patient.
Right.
Okay, so let's say everything goes well and the person now has a tracheostomy.
Okay.
What kind of tubes are we talking about here?
Well, there are different types of tubes,
Yeah.
and the handout talks about 3 main types: standard tubes, fenestrated tubes, and track buttons.
All right, so what's a standard tube?
The standard tracheostomy tube is usually white,
Okay.
and it's made of plastic. It's got an inner part called a cannula,
Okay.
which can be removed for cleaning.
Okay, that makes sense.
And there's a cuff that helps seal the airway and make sure all the air goes to the lungs.
Okay, so that's the basic model.
Pretty much, yeah.
What about the fenestrated tubes? What are those like?
Fenestrated tubes have little holes in them,
Okay.
and these holes allow air to pass through the vocal cords so the person can speak.
Oh, wow. So they can talk with a fenestrated tube. That's incredible. When would they use a fenestrated tube?
They're often used when someone is being weaned off a ventilator.
Oh, okay. So they're starting to breathe more on their own.
Right.
Got it. And what are these track buttons you mentioned?
Crack buttons are the smallest type of tube,
Okay.
and they're often used for long-term tracheostomies
Got it.
because they're less noticeable, and they allow for more natural breathing and speaking.
So it's like a step up from the bigger tubes?
Yeah, exactly.
That's cool. The handout also mentioned something called a Passey-Muir valve.
Oh, yeah.
What is that?
It's a little valve that can be attached to the tracheostomy tube,
Hmm.
and it helps direct airflow
Okay.
so that when the person breathes in, the air goes into their lungs.
Mm-hmm.
But when they breathe out, the air goes up through the vocal cords,
Oh, wow.
which allows them to speak.
So it's like a workout for the vocal cords.
Kind of, yeah.
Yeah.
It helps them get stronger.
This is really fascinating stuff. We've covered a lot of ground here today. We've talked about why someone might need a tracheotomy,
Right.
the different ways to do the procedure, the different types of tubes, but there's a lot more to learn.
Oh, yeah, for sure. There's a whole other side to this story.
Oh, really?
Yeah.
What do you mean?
We need to talk about all the things that can go wrong with tracheal airways.
Oh, wow. Okay. Like what?
Well, like complications from endotracheal tubes
Okay.
and tracheal lesions that can happen with any type of tracheal airway.
So the handout goes even deeper into the risks.
Exactly.
Yeah.
And it gets pretty interesting.
Well, I'm definitely intrigued.
Great. Then let's take a closer look.
All right, let's do it.
All right, so let's dive into some of the complications that can happen with these tracheal airways.
Okay.
We were just talking about tracheostomy tubes,
Right.
but first I want to touch on endotracheal tubes.
Okay, those are the tubes that go through the mouth or nose
Right, exactly.
down into the trachea.
Exactly. And they're really important in emergencies, but they can also cause some problems.
Yeah, I can imagine. Like what kind of problems?
Well, some are pretty common and usually not too serious. One is glottic edema. Basically, the area around the vocal cords gets swollen, and that can make it hard to talk and breathe, especially after the tube is removed, but it usually goes away pretty quickly.
So it's kind of like a really bad sore throat.
Yeah, you can think of it that way.
Is there anything they can do to help with the swelling?
Yeah, there are a few things. Sometimes they'll use cool mist or medications. Another common issue is ulcerations.
Ulcerations.
Yeah, those are little sores that can form on the vocal cords.
Oh, okay.
And they can make your voice sound raspy or hoarse. But again, they usually heal on their own.
Okay, so those are the common complications. What about the more serious ones?
Well, one that can be pretty scary is vocal cord paralysis.
Vocal cord paralysis.
Yeah, what's that?
Sometimes the endotracheal tube can press on the nerves that control the vocal cords. And that pressure can cause the vocal cords to stop working right.
So the person wouldn't be able to talk.
Well, they might have trouble speaking, or their voice might be really weak. And it can also affect their breathing, because the paralyzed vocal cord might be blocking the airway. It can be pretty serious. But the good news is that it often goes away on its own after a day or so.
Oh, okay, that's good.
Yeah. But in some cases, if the airway is still blocked, they might need to do a tracheotomy.
So they might need that more permanent solution. Right.
Wow. Okay, so vocal cord paralysis. What other serious complications should we be aware of?
Another one is laryngeal stenosis.
Okay.
It's a narrowing of the larynx.
Okay.
And it's often caused by scar tissue.
Scar tissue.
Yeah, remember when we talked about how the body sometimes reacts to injury by forming scar tissue?
Mm-hmm.
Well, the same thing can happen in the larynx
Okay.
after the endotracheal tube has been there.
Yeah.
And that scar tissue can make the airway narrower.
So it's like the airway's being squeezed.
Yeah, exactly.
What are the long-term effects of that?
Well, people with laryngeal stenosis might have a hoarse voice, or they might have trouble breathing, and they might make that noisy breathing sound we talked about earlier.
Stridor.
Right, stridor.
Yeah.
And sometimes they need surgery to open up the airway.
Wow. So we've talked about complications from endotracheal tubes. What about tracheostomy tubes? Do they have their own set of complications?
Yeah, they do.
Yeah.
Anytime you have a tube sitting in the trachea, the body can react to it.
Hmm.
And the handout calls these reactions tracheal lesions.
Tracheal lesions.
Yeah. And it can happen with any type of tracheal airway.
Okay, so tracheal lesions, what exactly are those?
They're areas of damage or abnormality in the trachea.
Okay.
And one of the most common types is called a granuloma.
A granuloma?
Yeah, it's basically like a little bump
Okay.
that forms near the tip of the tube
Mm.
or where the tube enters the trachea. And they're often caused by the tube rubbing against the lining of the trachea.
So it's like when you get a blister from a shoe that doesn't fit right.
Exactly like that.
Okay, so granulomas are caused by friction.
Pretty much.
What other tracheal lesions do we need to know about?
Another common one is tracheomalacia. Have you heard of that one?
No, I don't think so. What's that?
It's when the rings of cartilage that support the trachea soften.
Okay.
And this softening can cause the trachea to collapse inward when the person breathes in.
Oh, wow. So instead of staying open, it kind of caves in.
Yeah, exactly.
And that makes it harder for air to get to the lungs.
Right. And tracheomalacia usually happens right around the cuff of the tracheostomy tube.
The cuff.
Yeah, remember we talked about how the cuff helps seal the airway?
Mm-hmm.
Well, that's usually where the tracheomalacia happens.
Okay, so granulomas and tracheomalacia, those are the common ones. What about the less common but maybe more serious tracheal lesions?
Well, one that can be a big problem is tracheal stenosis.
Tracheal stenosis.
Yeah, it's basically when the trachea narrows.
Like laryngeal stenosis.
Exactly like laryngeal stenosis.
Yeah.
But this time, the narrowing is in the trachea. And it can happen at different points along the trachea, near the cuff, the tip of the tube, or the opening in the neck.
So it sounds like narrowing of the airway is a pretty common problem.
It is.
Whether it's in the larynx or the trachea.
Right.
And it seems like it always leads to breathing problems
Usually, yeah.
and hoarseness and that stridor sound.
Exactly.
Okay, tracheal stenosis. What else is there?
Well, we can't forget about that tracheoesophageal fistula.
Oh, right, that abnormal connection.
Yeah, between the trachea and the esophagus.
Where food can go down the wrong pipe.
Right. And that can be really dangerous.
How do they even know if someone has a tracheoesophageal fistula?
Usually they'll look for a history of recurrent aspiration.
Recurrent aspiration.
Yeah, that's when food or liquid goes into the lungs.
Right.
They'll also look for abdominal distension.
Abdominal what?
Distension. It's basically when the belly gets swollen.
Oh, okay. How does that happen?
Well, sometimes when people with a tracheoesophageal fistula get breathing treatments, the air that's supposed to go into the lungs
Yeah.
ends up going into the stomach,
Oh, wow.
which causes the belly to swell up.
So the air takes a wrong turn.
Yeah, exactly.
Okay, tracheoesophageal fistula, got it.
Yeah.
Anything else?
One more, and it's a pretty serious one. Tracheoinnominate fistula.
Tracheoinnominate fistula.
Okay, that sounds intense. What happens with that one?
Well, this is when the tracheostomy tube actually wears a hole into an artery in the chest.
Oh my gosh.
Yeah.
That sounds really dangerous. It is. It can cause massive bleeding.
Are there any signs that that's happening?
Sometimes the only sign is a pulsating tracheostomy tube.
Oh gosh, I don't even want to think about that.
Yeah, it's definitely a worst case scenario. But thankfully, it's very rare.
Okay, well, we've definitely learned a lot about the potential complications of tracheal airways. It seems like there's a lot that can go wrong.
There is.
But it's also amazing how resilient the human body is.
It is.
And how medical professionals can often intervene and fix things.
Absolutely.
So let's put our knowledge to the test.
Okay.
The last section of this handout presents some scenarios,
Okay.
and we have to figure out what's causing the problem.
Like a medical mystery.
Exactly like a medical mystery. Are you ready to play detective?
I am. Let's crack this case.
Okay, so we've got our detective hats on, and our handouts ready.
All right, let's see what we've got.
Laying out the clues.
Yeah. What's the first case?
First scenario, we have a patient who's having trouble swallowing.
Trouble swallowing.
What do you think?
Trouble swallowing.
Yeah,
Well, we talked about a few things that could cause that.
right. Could it be tracheomalacia?
Tracheomalacia.
Yeah.
That's a good thought. But remember, tracheomalacia mostly affects breathing.
Oh, right.
That collapsing trachea makes it hard to get air in.
Yeah, right.
But it doesn't usually cause trouble swallowing.
Okay.
Trouble swallowing usually means there's a problem with the esophagus or the structures around it.
Okay, so what about that tracheoesophageal fistula?
Ah, the tracheoesophageal fistula.
Yeah, that abnormal connection between the trachea and the esophagus.
Yes,
Could that be it?
that could definitely be it.
Yeah.
If there's a connection there, food could end up going into the lungs instead of the stomach.
Yeah, that would definitely make it hard to swallow.
Right.
And it could also cause aspiration.
Exactly.
Okay, so maybe that's our culprit for this case. What's the next one?
All right, case number 2. This patient is wheezing.
Wheezing. That usually means the airways are narrowed, right?
It does. What do you think is causing the narrowing?
Well, it could be tracheal stenosis.
Brachial stenosis.
Yeah.
Good thinking.
Yeah. Remember we talked about how the trachea can narrow from scar tissue or excess tissue growth, or even that tracheomalacia.
You got it. It could be any of those.
So many possibilities. It really shows how important it is to have a good doctor.
Oh, yeah, for sure. Someone who can really figure out what's going on.
Yeah. Put all the pieces together. All right, what's next?
This next one's a little tricky. The patient has orthopnea.
Orthopnea.
Yeah.
I don't remember that one.
It means they have trouble breathing while lying down.
Oh. That's interesting. Is that related to the tracheal airways?
Well, it can be caused by a lot of different things.
Okay.
Heart problems, lung problems. It's not always specifically a tracheal airway issue.
So this one's kind of a curveball.
Yeah, I think they threw this one in there just to make us think.
Okay, well, let's move on to the last one then. What is it?
The last symptom is hoarseness.
Hoarseness. Oh, we've talked about that a lot.
We have.
It seems like it could be caused by so many things.
It can.
Vocal cord, inflammation, ulcerations, polyps, granulomas, vocal cord paralysis. It could be anything.
You're right. Hoarseness is a common symptom for a lot of different problems with the vocal cords. It's up to the medical team to figure out what the underlying cause is.
So we've got to use all the clues to solve the mystery.
Exactly.
I feel like we've been on an incredible journey with this depth dive. We've learned so much about tracheotomy, from the basics to all the possible complications. It's really amazing how much information they packed into this one little handout.
I know, right? It's like a whole medical textbook in a few pages.
And it just goes to show that you can learn a lot if you just dive in and explore.
Absolutely. But before we wrap up, they leave us with one final question. Ready for it?
Hit me with it.
They ask, knowing the variety of complications that can arise, what advancements do you think the future holds for tracheotomy procedures and technology?
Wow, that's a really good question. It really makes you think about the possibilities.
Yeah.
Like, what if we could create tracheostomy tubes that are less likely to cause irritation or inflammation?
Right. Or what if we could personalize the tubes to fit each patient perfectly?
Yeah, like custom-made tubes.
Exactly.
That would be incredible. And it's not just about the tubes themselves.
Right.
Maybe there will be new surgical techniques that make the procedure even safer. Or maybe we'll have better ways to monitor patients and catch complications early on.
Yeah, there's so many possibilities.
So what do you think, listener? What kind of advancements would you like to see in the future of tracheotomy care? Let us know. Join the conversation on our social media channels. And in the meantime, a huge thank you for joining us on this deep dive. Keep exploring, keep asking questions, and we'll catch you next time.